There's a lot of activity in the research field for CLL to come up with treatments that are first chemotherapy-free. I think we've achieved that. Two, to make it time limited and provide a treatment that can not only control patients' disease, but also give them the opportunity of being off treatment and hopefully for a long time. And so the time limited and maybe all oral therapy, so it would be nice to avoid intravenous therapy and infusions. And so I would say oral non-chemotherapy time limited strategy would be extremely helpful if we can come up with a regimen that can provide that. Now, there are a number of clinical trials that are ongoing or planned, and we're hoping that eventually that will be a treatment option for our patients. Of course, we have a look at cure as well. So if these remissions are long enough that, at least for the average age of CLL patients in their expected life, they don't have a recurrence of CLL, we can maybe call it a functional cure. But the first step is to have long remission with these time-limited therapies.